Anyone can benefit from your program that has any kind of pain, rehabilitation issues. I would even say people maybe that haven't gone through stem cell, issues, because I've had other minor issues that, like I said, Dr. Brandon's been able to identify and help me resolve in a session. My name is Darryl. I'm 52 years old, and I found out about your office and your physical therapist through uh, CPI Institute in Tijuana. I've actually been an athlete since I was a kid and have had multiple knee surgeries, bone breaks, sprain strains, all kinds of issues. But here as an adult and competing on an elite level with CrossFit, I tore my shoulders in a competition in 2023, actually, labral tear and supraspinatus and infraspinatus tear on both shoulders. So it was painful. Like, I was able to get through the competition. I was still able to train, and I did compete a couple more times after that, but it was very painful. My performance was lacking, and then day-to-day tasks, just things like simple things we don't think about, like after when you clean yourself after a restroom break, or just grabbing, something out of the pantry, was very difficult. Or even one sport that I love, golf, just pulling a club out of a bag was intense pain. My backswing, I had to take it down to a quarter of a swing because I couldn't go all the way back because the pain was so intense. Sleeping on my stomach, another thing that I like to do, and I could not do because the pain was excruciating. Super important. I just went through a discussion with my mental strength coach here because this was a difficult time period, the last 2 years of going through this rehab process. And, it's a slow process, but it works. I wasted the first year with my regular physical therapist and my coach, and we thought, based on the guidelines we had received, we were good. But no, this second time around, once I met with your group and worked with your therapist, Dr. Brandon in particular, it was phenomenal. There was a huge difference, but it was also the activity level was taken so far back. And so I went through it was almost like a state of depression, not being able to do what you want to do on a daily basis or be as healthy as you want to be. And so, discussed a lot of times with my mental strength coach, and we actually got to the conclusion that literally a couple weeks ago, that in order for me to be the best person I can, and from being empathetic, a good communicator, um, and just live a different way with the energy that I have, I need to be at my best physically. So that's what drives me. That's what drives my life. So without the lack of pain, without being able to do what I want to do, life becomes more difficult, not just for me, but for all the people I love around me too. Before I found you, was how quickly would I be able to return? What could I do? How could I do it? That wasn't spelled out or labeled ahead of time. And what's funny is, before I found you, my concern, because it was my year follow-up to get my second round, when I went to see the doctors, I had this whole speech ready about how they needed to hire a physical therapist or group and get the experience, even if it wasn't good at the beginning, just to make this valuable for the patients, because it's not that injection that does the magic, right? The stem cells are the magic, are the glue, but without what you do afterwards, you've wasted every penny or every ounce of time that you've driven into this process. So it's the recovery that's more important than the actual injection. Yeah, so I started initially with my personal physical therapist, who I've seen for 6 years, knows me inside and out. But she did not have experience with stem cells. And so when I went back to CPI for my follow-up after the year and things still weren't right, they recommended your group. And they said, look, we just started working with a group. And I was like, oh, now you tell me. Pleasant surprise, better late than never. I'll take it all day long. But it was shocking, that first call with, Brandon, and, telling me I had to limit my steps and what I could and couldn't do. And it felt like baby steps, but it also felt good to be able to have a plan, have somebody who at least had a guideline and was able to guide me, and I was seeing progress throughout the process. Be honest, so I was concerned being in San Diego and me here in Cleveland. The fact that we're able to do this over Zoom, virtual, visits, and Brandon's been able to pick things out that I haven't had physical therapists notice before, or be able to fix something just through viewing it through the screen. There's no need to touch, feel, see, right? Well, see, it's just through the lens of the camera. So pretty amazing, the process that your group has developed there. Oh, immediate. I mean, immediate. Probably, at the 2 month mark, I was moving faster than most, I think, just because of the training, or whatever I had in the past. Something was a little bit different. But I was able to push weight sooner. Pain started going away sooner. I was ahead of schedule, according to Dr. Brandon. He's like, Darryl, you're a little bit out of schedule. We've talked about this. I've reviewed this with other people. We feel comfortable moving you, but let's limit the pain levels if you get to this. If you get to a 6, we got to go backwards. You know what I mean? We have to talk about this. So that was a good guideline, because if you push, where can you push to? And I'm great at pushing things too far. Able to run again pain-free, able to do pull-ups, hang from a bar, doing work on the rings, gymnastics works on the rings, wall walks, things like that I couldn't do without pain. I mean, and to be honest with you, this summer I've realized just being able to golf pain-free, just makes it so much more enjoyable. I'm not a competitive golfer by any means, but man, it makes it so much more enjoyable when you're with friends and you can enjoy it. So I would think most people are going to be skeptical. My CrossFit coach, who is brilliant with movement patterns, and he went to the CrossFit Games himself, and just is very good with managing his body aches and pains, muscle, soft tissue work. He didn't understand. He's like, how can doing less help you more? But he let the process play out. I told him, look, Phil, if I'm going to invest in this time, we got to let this go. We got to let's see what I've already wasted a year. What's another 6 months? So he saw the benefits and the improvement right away. He still doesn't understand it fully, but obviously there is a system. There's experience, and there's good guidance. Oh man, I would say anyone can benefit from your program that has any kind of pain, rehabilitation issues. I would even say people maybe that haven't gone through stem cell, issues, because I've had other minor issues that, like I said, Dr. Brandon's been able to identify and help me resolve in a session, that I've never been able to resolve before. Yeah, I mean, what I would say is it's a very welcoming environment. Everybody there seems to have, a smile on their face, good attitudes. You get answered with a greeting, a nice greeting, a warm voice. That's not normal in the healthcare space, not everywhere you go. So it is very nice, because the company does look to help the client. You're always trying to make sure there's always an assessment phase right at the beginning. We're discussing pain levels, we're discussing activity levels, and then digging in. So it's not just a cookie cutter approach. It is very personalized.
If you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.